Hi, thank you, Anthony. So Pam and I spend quite a lot of our working life going into various practices and doing, well, I do mock PSS inspections and Pam does real ones, but the same things come up over and over again, and we also come up against this, regularly come up against people who misunderstand various things. So we thought that if we did this webinar to try and myth bust about the way the new PSS awards work, that it might help you all out there. So just to introduce ourselves, I'm Jackie Molyneux. I'm chair of the Practice Standards Group. I have been for the last 5 years, I think. And so I have been very much involved in the new scheme and introduction of the awards. And Pam is the lead assessor of the Practice Standards Scheme and keeps all our assessors who all underwent all sorts of training, she keeps them all in line. So the first thing, even though this slide is headed changes to the scheme, this is just to reassure you that the basic part of the scheme stayed the same. So the accreditation levels at core, GP and hospital are exactly the same as they always were. So there is nothing that you have to do now to get into those categories that you didn't have to do before. The only difference is that the way the manual is set out. So we took every single standard and we organized them into modules, and we'll talk about why we did that a bit later on. So the major changes to the scheme are that we introduced an equine general practice ambulatory, and the reason we did that was because a lot of practices who were doing much more than core level services couldn't come into the scheme at GP level if they were equine because they didn't have stables, because all their work is done out in the field. So BEVA asked us to do this new category, and we did, and there are quite a number, certainly in the teens, of practices that have come into that. So we're very pleased with the uptake of that. So as I said, the new scheme has basically a modular structure, and one of the things about that is that it means that rather than one person being responsible for the whole thing, it's fairly easy to break the manual down into the modules and give those modules to a different member of staff. So for instance, you can have the nurse, one of the nurses could do the nursing section, the nursing module. Another one could do the surgery module. Another person can do the customer experience module. Quite often that's the chief receptionist. But by doing that, we find that you get much greater buy-in from the team than you used to. And it means that one person isn't chasing their tail, trying to run around doing everything and getting lost and bogged down with it all. So there are 3 separate manuals. The old one used to have bits of each in everywhere, and we decided actually it would be much cleaner and easier if we have 3 separate manuals. We have one for farm animal, which is the green one at the top, the yellow one is the small animal, and then the blue one is the equine. So the important thing to remember, or one of the important things to remember, is that this is not the Royal College sitting there in our ivory tower dictating what the practices have to do. The Practice Standards Group have representatives from all these organizations, and we meet very regularly, and when we get report back from our assessors that one particular standard is causing a problem, or the interpretation of that standard is causing a problem, then we as a committee will discuss it, and we will change that standard if we think it needs to be, or we say no, this is how it needs to be interpreted, and we advise the assessors how to interpret it. But it's just important that you understand that it isn't the Royal College dictating all of this. It is a whole group of us, and we regularly will discuss the scheme and how it needs to be changed. So it's evolving as well as undergoing a revolution a year or so ago. So the new scheme definitely considers what matters. It considers what impacts on the veterinary care of animals, and it very much focuses, the awards part very much focuses on behaviours and outcomes. The old part, so the base accreditations, still concentrate on facilities and equipment, because as I said, that's all the old standards were just taken across and modularized. So the base accreditations are just the same, and they do concentrate on facilities and equipment. But the awards very much impact on the behavior. So we want behavior that's embedded into the practice culture and does affect the outcomes of the veterinary care. It also provides a pathway for practices to improve. So if you're not sure how good or bad, not bad, but good or average, say, your customer care is, you could look at the manual and see all the things that are in there under the awards to see where you could improve. And we have found that practices actually use this as a ladder to improve what they do in various sections. We hope that the whole scheme is understandable and clear to the public. That's an ongoing battle that we undertake, that we've been to the London Pet Show and various other things, just to try and get this message across to the public. So the awards were introduced in 2015 when the new scheme was launched. And the first thing to understand is that the awards are optional. So people can come into the scheme and they can just do the base accreditations at core, general practice or hospital. They do not have to do any awards at all. They are there to allow people to show, or allow practices to show where they excel, and provide these awards that are based on the Ofsted type designations at good or outstanding in each of the sections. So yeah, it'll become apparent in a minute how the modules work with this. So each of the awards are made up of modules, and to achieve good in an award, practices have to get 60% of the points available in each module of that award. And I've got a slide a bit later that show you how the modules fit into each award. To achieve outstanding in an award, practices have to get 80% of the points available in each module of that award. And the important thing about this is it means that you don't have to cover every single line, because there are some things in a module that you might not have the piece of equipment, or you might not have the necessary training, or you might not want to use this particular method or process. So it means that you don't have to do every single little thing. So these are the 6 awards. We have team and professional responsibility, client service, patient consultation service, diagnostic service, inpatient service, and emergency and critical care service. So the team and professional responsibility, we think, will become very important insofar as recruitment of staff, because it helps you, you can illustrate that you look after your practice team and that you're doing the professional, responsible things properly. Client service is what it says on the tin. It's very much about customer care. Although it's only got 1 module in it, it's very long. So although it's 1 module to get a whole award, it's probably the same length as putting some of these others together. The patient consultation service is meant to cover sort of the first opinion part, so the front of house, if you like. And you can see the modules that go into that. The things that we went through and put the things that we felt were particularly important for that part into there, and you can see that things like infection control cross over several different module awards, and pain management goes into several different awards. So you can do 1 module and actually that will fit into several awards. The diagnostic service is all about imaging and lab. Inpatient service is the care of the animals that are in with us, and that's meant to mean basically the animals that are taken away from the owners to come into our hospitals or our clinics, either as inpatients undergoing treatment or diagnostic tests, or coming in for surgery. So you can see that the modules that are included into that award all cover the things that are important for animals that are actually being taken away from their owners and taken into our care. Now, the emergency and critical care service, people tend to dismiss this as being only for practices that are doing their own out of hours, and I think we have to try and separate our minds from thinking emergency and critical care is only out of hours, because a lot of practices are doing lots of emergency and critical care service, even if they don't do their own out of hours. So although you might not be doing 24-hour coverage, you still can do emergency and critical care award, because it's all about how you care for those animals when they're in. So just to cover the farm animal awards, there we have 5 awards for them. You can see them listed here, and it's broken down in a similar sort of way. But there are things that are different. I'm just trying to see. There's a consultation, and I can't see where it is. In fact, I can't see it at all. Oh, okay. So the award is the consultation service, but you have things like infection control and pain management and things. Again, this was worked up with BCVA. They played a very large role in making sure this is relevant to farm animal practices, rather than just being an obvious small animal section that was being changed to cover farm animal. This is very much written for farm animal practices. The equines, they're probably more parallel to the small animal, but again, they've been changed as we were asked to by Beaver to become very relevant for equines. And the feedback we've had is that people have found the new scheme is very much more relevant to the types of practices that they're actually doing. So as we said, the awards focus on behaviours and factors impact upon the veterinary care of the animals and of the team and of the experience of the clients. And they're there to recognise excellence. Now, one of the things that allows to happen is that you can market your practice as being outstanding, say, in client experience. And in my practice, we found that's a very, very potent marketing tool. So we use it quite a lot in our Facebook posts, it's publicized within the practice. We will mention it whenever we can. And certainly the client experience is the award that we have found that most practices are starting with. Now, it's not necessarily right for every practice, because as I said, it is a very long module, but it certainly is a good place to start, because research has shown that clients can't really judge how good or bad your clinical work is, but they sure as hell can judge how good or bad your customer care is. So to give you some ideas of lines or points lines from each of these things. So in the Client Service Award, one of the things is that clients have CPD, and their communication and handling of difficult situation training has been undertaken in the last 4 years by a team member. And the important bit is this last bit, who has provided internal training to the rest of the team. So it's not good enough that one person in the team has gone off to it's usually VDS or various other people who provide this, but it's not good enough to just one person go off and undertake that training. They have to have come back and they have to have provided internal training to the rest of the team. And that has to be proven to the inspector, to the assessor. And for that, you get 20 points. So a similar thing is for bereavement counsel training. So again, a team member has to have undertaken that training in the last 4 years, but that isn't enough on its own. They also have to have provided internal training to the team. And that's worth another 20 points. Team members received training in customer service within the last 4 years. You can see that the way the points work is that the more important we think something is, the more points it gets. So some things even have as many as 50 points. But 30 and 40 means that we think it's important. Again, still within client experience, a range of media is used to communicate and interact with clients. So that may be a website, a Facebook page, an electronic newsletter going out. It can be paper adverts going out. It can be client evenings. I mean, all sorts of different ways that you can communicate and interact with the clients. And it is very much up to the assessor to agree whether there is a range that's being used. If you monitor the time taken to answer the telephone, you can get another 20 points. Now, there's quite a few practices who have got electronic recording of phone calls now, and as part of that, I think it is automatic that it will monitor the time taken to answer the telephone as well. So you can kill two birds with one stone and have your phone calls recorded as well as fulfilling this. I'm not suggesting that, because it is expensive, I'm not suggesting you would only do it to monitor the time the telephone takes to be answered, but certainly if you are recording your phone calls, which I actually think is a very good thing to do, this is a side effect, if you like, of that. So we also want you to collect client feedback. So how could you do that? You could just have a little box somewhere and some forms. asking people to give you comments. And most of the time they're good, and occasionally they will put a minor complaint or a niggle into there. And the important thing then is to act on it. So you can see that we give 10 points for collecting it, but 30 points for acting on it. So it just needs to be someone's job to collect that feedback, to pick up, say, those slips of paper once a week or so, and then to feed back to the team at a team meeting a suggestion that's come in, and then you agree how you can act on it. You can see you also get 30 points for the use of the Royal College pre-PSS assessment client questionnaire. Now, people get quite worried about that, so we thought we would just tell you a little bit more about it. So this is sent out to roughly 50 clients per full-time vet equivalent, and this is what they receive. This it can be done on an iPad in the waiting room, or it can actually be emailed out to clients if that's what you want. But this is the sort of front page they get, and then they are asked to rate the client on each of these things. So ease of appointment, approachability, explaining condition, involving you in the decisions, providing or arranging, I can't remember what the rest of that sentence is, keeping you informed of progress, keeping you informed of test results, things like that. And the client basically will rate your practice from 0 to 10. And at the end of it, you will be given a promoter score, so a net promoter score. And this practice is doing very well. Their net promoter score is 60. So you can see that so people that score you between 9 and 10 count as a promoter, between 7 and 8 are passive, and detractors are 0 to 6. And basically the net promoter score is all of your promoters minus your detractors. So you can see that you have to do quite well to get an NPS of 60, but that's what we're looking for. Oh. Now, why did that go back? Next. Okay, so in the client experience module, as I said to you, there's a total, it's a big module. There's a total of 540 points available. So to get outstanding, you have to score 430, and to score good, you have to get 320 points. Now, as I said, that means you don't have to do every single line. But if you start looking at them, you'll probably be quite surprised at how many you are already doing. And certainly it gives the reception team a good starting point for them to know where they can start to climb up the ladder of improvement. So I'm now going to hand over to Pam, who is going to give you some tips about how to go through this. So over to you, Pam.
Hi everyone. Hi. As Jackie said earlier, my name's Pam. I'm the lead assessor for RCVS Practice Standards. We've been looking at the awards now for sort of 18 months in practices, so I thought I'd just go through, as Jackie said, some of the myths about the awards and some hints for those of you who want to do the awards. So first of all, as Jackie said, the most important thing to remember is the awards are optional. We've had lots of confusion with people contacting us thinking that they have to do, when they look at the manual, they look through core, GP, hospital, and then they look at the awards and they get in a panic and think they've got to do everything for their one-day assessment, and you don't. The awards are optional and usually done on a different day to your assessment. So don't, please look at the awards and see if there's something you want to do, but don't panic and think you have to do it all on the day that you have your assessment. They're completely optional. As Jackie said, you don't need to do them unless you want to. And they are assessed separately to the base accreditation levels because they are a different mindset. They're a different mindset for the assessor as well as a different mindset for the practice, and are assessed in a different way, which we'll go into. They're assessed much more by talking to your team members and finding out what really happens, and not so much by looking at bits of kit or looking at the building or looking at a piece of paper. So any practice can do the awards as long as they are already in the scheme and already accredited, but they must be at GP level in the modules that are involved in the awards. Now, that doesn't mean that you have to be a GP practice to do them. Core practices can do these awards, but the modules that they're doing the awards in, they have to be at GP level in those modules. So if they're doing client experience, which a lot of core practices have done, then as long as they're at GP level in the client experience module, that's fine. Same applies in the team one, as long as they're at GP level in medicines and infection control, etc. They can do that. So they are open to anybody, be you a veterinary hospital or a core standard practice. You have to apply to the practice standards team in London separately to do the awards. As I say, they don't automatically do them with your assessment, and they generally done on a different day, because as I say, the mindset's different and you need time to prepare for them. And as Jackie said earlier, the really important thing with these awards is that they do focus on behaviours, on outcomes and systems of work, on what you really do. And we're going to find out about what you really do by talking to your team members, and they will let us know what happens. So can we have the next slide, please, Jackie? Thank you. So the awards are judged on the day. Now, you know, those of you who are already accredited practices, you will know that for the core GP hospital accreditation, if there's something that you're not doing, then the assessors will let you know, and it will be on the report that gets sent, and you'll be able to send in evidence with a timescale of 1 month or 3 months or 6 months. But for the awards, you can't send in evidence afterwards because, as I just said, they're about behaviours and systems of work. Now, if you are not doing it on that day, sending us a piece of paper a couple of weeks later to say we're doing it now is not going to really work. It's got to be, so it's judged on the day. So that's why it's really important to prepare. Now, if you don't get the level that you would like to get on the day, then you can apply to be reassessed. So if you wanted to be outstanding in client experience or good in team and professional responsibility and you didn't achieve that, you can apply for a reassessment. But we'd like you to leave that reassessment for at least 3 months, because, as I said before, it's about systems of work and behaviours, and you can't change those overnight. For something to become part of the practice culture, it takes at least 3 months for that to happen. So that's why we'd like you to leave at least 3 months in between. So these are my sort of top tips, if you like, for practices when I'm talking to them, when they ask me whether they should do awards. Well, the first thing I say to practices is don't try to do too many awards at once. We have practices saying, oh, well, I think we'll do all 6 and we'll be outstanding in all 6. Well, they may do. And there are 1 or 2 practices that have done that, but they haven't done that all in one go. So don't try to do too many awards at once. Generally, 2 awards in a day is a good amount to do. Sometimes we can do 3 awards in a day because, as you probably noticed when Jackie showed you the awards, some awards have modules. Some modules are in more than 1 award. So if they have modules that are in both awards, then it may be possible to do 3, but that is quite a long day and a lot of preparation for the practice as well. We definitely can't do more than that. 2 is ideal. You can just do 1, or the other thing you can do is choose 1 and do it across different branches. I've had practices that choose to concentrate on client service award, and they do it at their main surgery and 3 branches and the farm practice. So, you know, you can either concentrate on one area across branches, or you could do a selection of awards. Okay, we'll move on to the next one. So when you're deciding which awards to go for, well, there's 2 ways that people approach this. I think the commonest way is to look for what you excel in already. And the practice will think, okay, we excel in this, so that's what we're going to do. So, you know, we excel in outpatient consultation, or we're really great at that, so we want to go for that award, or we really excel in diagnostic imaging, so we want to go for that award. But the other way to look at it is to look at an area you want to prioritise in the practice. So you think, well, really, we think that our client service, as Jackie's just said before, may not be absolutely optimal. I think we've got room for improvement. So if we go for the award, we'll prioritise that. We'll take the next 6 months to work on it in all our different branches and departments, and then we'll go for the award across all the departments. So it's either, I mean, look at it carefully. Not that many practices do all 6 awards. Practices tend to look at what their niche is and look for those awards, or the ones that are particularly relevant to them. So moving on to the next slide. As I said before, when you're choosing your awards, don't forget you have to achieve GP standard in all the modules in that award. And if you've recently had your PSS assessment, then you need, and you've had things you need to send in as evidence for the GP level, then you need to have done that before you can actually get your award. So that's why it's much better to do it on a completely different occasion. And the way lots of practices have been doing this is they've had their assessment, they've had their assessor come out, do their normal GP and farm GP and core equine and veterinary hospital assessment, and then the assessor discussed with them and said, you know, you'd really be good at, you ought to think about doing some of the awards and then they've talked to that assessor and arranged for them to come back in 3 months or 6 months to do the awards, and that gives them time to clear up any bits and bats they've got at GP level so they're all ready to go with the awards. My next tip would be self-assess, and be quite critical of yourself when you self-assess. It's human nature, isn't it, that we whiz through it and think, yeah, we're doing that, tick all those boxes, but actually look at it carefully and think, are we really doing that? If the assessor came and talked to our team, would they tell her or him that we were doing that? So, and when you self-assess, as Jackie said, it's 60% for good, 80% for outstanding. So if you want to be outstanding and you have a look and self-assess, don't just be content with 80%. Make sure that you've got a little bit more than 80% in the bag, if you like, so that if there's any discussion or discrepancy between what you think and what the assessor thinks, there's a little bit of leeway there. So go for more than you need. So go for more than 60% if you're going for good, go for more than 80% if you're going for outstanding. And one way to self-assess is to use Stanley, our new online administration and support tool, which is up and running for some practices now. And the good thing about Stanley, apart from the fact that you're going to be able to upload all your evidence on it, and the assessor's going to be able to look at the evidence, and it keeps it all in one place, and it's working really well. And it does a calendar for reminders, so if you put a time-sensitive document on, it will be able to send you a reminder. But the other really good thing about it is that it has the self-assessment tool. And those of you who are involved in nurse training, it's very like the nurse progress log. You can actually see a little bar that moves across. So as you confirm that, yes, we do that, carefully confirm, think about it, look at what the evidence is, you move that along, and then you can think, okay, right, we're now up to 68%. Now we want to be good, so we'll push the button and say we'd like to have our assessment. So use that self-assessment tool. I think you'll find it useful, and hopefully you're going to find Stanley very useful. It's certainly, the practices that are just starting to go through it are certainly finding it useful. So moving on from that one, prepare. Like, really, it's location. I can't emphasize enough that this is not something, I mean, you're charged for the day when we come out. So, you know, prepare properly for the awards. Don't suddenly decide at the last minute to add in another award that you haven't really prepared for. I mean, you can do that if you want to, but you're not that likely to get your good or outstanding level in that award. And make sure that you take lots of time to prepare. So read it carefully. If there are some documents that are required, a lot less than they're required for the base accreditations, but there are some documents. So upload those documents in advance to Stanley, and your assessor will be able to look at them and tell you in advance if they're okay. And then read the module, and all modules have the same structure. As Jackie showed you with the client experience module, they start with CPD. That's the important thing in all modules. It starts with CPD, a requirement for CPD, which is not just one person going on CPD, it's actually spreading that information to the rest of the team and altering what you do as a consequence. That's the important thing. Then and in that CPD section, you can get points for having people with further qualifications too, in things like anaesthesia and surgery and so on. Then it goes on to training, general training of your team. Then, if you like, there's the main structure of the award, all the other things. But all awards finish with a requirement for clinical audit. And that's really important. And I thought I'd just mention that a little bit because it's a bit of a source of confusion with practices. People panic a bit when they see the words clinical audit. It's not anything to panic about. It's quite a simple thing. So moving on to the next slide. As I said, most modules have a clinical audit component. So looking at the first module, anaesthesia. The last clause in the anaesthesia award module is anaesthetic procedures are subject to clinical audit. This could be outcome, process, or significant event audit. So that means it could be an outcome audit. An outcome audit is where you tend to measure things. This is what most people think of as clinical audit. So for anaesthesia, it could be, unfortunately, anaesthetic death or anaesthetic complications. You could measure the rate of those in your practice. It could be a process audit. Now, process audits are about looking at how something's performed. So if you have a protocol for certain things, then looking at how you comply with that protocol. So there might be a protocol in your outpatient section protocol, a clinical guideline for how often you would blood sample diabetic cats or hypothyroid cats. So you can actually monitor, you can do this retrospectively, looking at records, how well you're complying with that protocol or guideline, or clinical guideline. Another process audit, and process audits are can be quite short and quite easy to do and really useful. Going back to anaesthesia would be, you can actually audit the use of your anaesthetic monitoring sheets. You can see that they all have the correct information on them and that they've been filled in at the correct intervals. You've got the induction agent, the pre-med, everything on there. And then if as a result of that you find that that's not the case, you can have team training and discussions and then audit again when you've implemented and you've had your team training and reminded everybody to fill them in properly. You can audit off-license consent forms, you can audit anaesthetic consent forms, all sorts of things can be processed, audited. And it can give you some really useful information which can make a real difference about how you work. And then also the significant event audit. So this is when something goes wrong or when it goes really right. So for getting back to anaesthesia example, yeah, a significant event audit is a no blame meeting where we discuss what's happened, we look at the timeline, we look at everybody involved, and everybody has a chance to input in a no blame way because we're trying to improve systems, we're not about trying to blame people. And then we look at if there's anything we could have done differently. So you might have a significant event audit because of an anaesthetic death. And you might look at, say, a rabbit dying under anaesthesia. You might look at what you could do differently. Somebody may go away and look at the evidence base, look at whether the protocol you're using for rabbit anaesthesia is the one that is probably the best to use, looking at what evidence is there, maybe some CPD requirement, maybe some team training requirement, and then a re-audit. But you could also have a significant event audit when you had an animal crash and you had a successful CPCR. You could think, great, that was fantastic. Nobody thought that animal was going to come back. What did we do then? You know, and then talk about, well, the people who were there on that day had the training, but the rest of our team haven't had the training, so we're going to do the training. So it's really just a way of looking at what we do. So don't be scared by the fact that nearly every module has a clinical audit component. Just look at each one individually and look at what you want to audit. It could be, you know, filling in of pain scores, anything. So getting on to my next top tip, because I could wish on about audit all day. The behaviours and systems of work we're looking at need to have been in place for at least 3 months. So when we talk to your team, we need to know that they can tell us exactly what's going on. And you soon get an idea. The assessors ourselves were a little bit anxious about doing this to start with, but it's amazing how easy it is. If you talk to a group of 3 or 4 people, they just start chatting away about a subject, and it soon comes out what actually happens. And if this was only introduced last week, if some system of work was only introduced last week, half of them are not going to know it's changed. The other half may know it's changed but not be doing it. It's got to have been in place for at least a good 3 months to become part of the practice culture. So don't go for your awards too soon, is what I'm saying. Make sure you prepare and make sure those behaviours and systems are placed, systems are really happening. What are actually happening in your practice, not just what we're not interested in a piece of paper that says this is the protocol for repeat dispensing of medicines. We're interested in what actually happens when somebody rings up and talks to your receptionist. Okay, moving on to my next tip. Use your assessor. If you're unsure about a clause, you will be allocated your assessor. Often, as I say, if you've just had a routine assessment and you've got on well with your assessor, then that will be the same assessor who's going to come and do your awards. And by this time, your team will have met them, so they're not going to be worried from that point of view. So, and if you're unsure about a clause beforehand, contact your assessor. Use your assessor to say to them, I think this is what is meant by this. Is that what's meant? Have a conversation, because the more of those sort of things that can be sorted out in advance, the better for you and the better for the assessor. We've now got 21 assessors. As Jackie said, we're professionally trained. We had outside training from VDS, VMD, an agency that does some assessing in human healthcare scenarios, and hope that we are achieving high and consistent standards of assessment. As lead assessor, I read everybody's reports that come in to try and ensure consistency between us for the practices. So but really do use your assessor to help you through the awards. Okay, moving on to the next one. Get the whole team involved. These are not awards that are just clinical, okay? Like the Client Experience Award, I've been so surprised with how pleased and surprised with how motivated, particularly client service teams can get. It's a great chance for the receptionists who maybe, you know, and don't have the chance to achieve as many further qualifications or whatever, but they can do this award and they can feel really proud of it. So, you know, get everybody involved. Make sure it's not just the vets or not just the nurses, but there's absolutely everybody in the practice. And then number 9 follows on from that. There's got to be plenty of them for us to talk to when we go. It's no good if when we get there and you're doing a nursing scenario, a module, and the only nurse is a very young, brand new trainee who's very, very nervous about the whole thing and doesn't really open up much to us. Then we can only give you the points based on what she's told us. Whereas if we've got 3 or 4 nurses who are chatting together, like I said before, we soon find out what's happening. So if you're doing client service, you want your whole client service team. You don't just want one person who's also trying to answer the phone and deal with the front desk. If you're doing nursing, you want your nursing team. If you're doing patient consultation, you want your vets team. We've all discussed the clinical guidelines and to tell us how they drew them up, how they looked at the evidence base, how they're using them, etc. And then last of all, when you've put all that work in, then celebrate your success. Now you can celebrate your success, and Jackie will talk about this in a minute, by putting a big banner outside to say you're outstanding in client experience or whatever. But the other way, what I've really found, and that's why a lot of practices want to do it, but what I've really found is the really, really important thing is how much this motivates the team. You know, teams have been so excited by it and so motivated and so pleased with themselves, rightly so, from achieving the award. And we do have some award ceremonies. That one on the screen was at BVNA. We had one at BSAVA, and we're going to have one at SPIVS BPMA. So we're going to taking these around where you can actually, your team members can actually go and receive their award from the president of the college, and you can get a photograph to put on Facebook. So over back to Jackie now to talk about promoting your award.
Hi, thank you, Pam. So, as Pam says, one of the things that is really important is that you promote your awards. So you get these plaques that can either go on the wall, or as you saw in the previous slide, they can be little sort of freestanding things. But it's important that you don't just put these on a shelf and forget about them, because there's a hugely powerful marketing tools. So the Royal College will be developing more and more of a marketing toolkit, but at the moment we certainly can give you advice on how to promote your awards. We can give help with writing press releases. People have gone on the local radio and even local TV to promote their awards. As I said before, putting things out on Facebook and Twitter and Instagram. I'm far too old to know how to use Instagram, but certainly that's something that the youngsters are using lots. We had an open day. If you go to careers days at local schools, you can promote the fact that you've got outstanding or good in team and professional responsibility, and that's sort of a two-way street, because by going you get points in that and you can go there and promote your award. Photography, take lots of photos. People on Facebook and Twitter and Instagram absolutely love photos and videos, so anything you can do they will look at. So Royal College provides some of the marketing materials. We provide plaques, bookmarks, leaflets, posters, videos. I hope most of you have seen the video that is promoting the Royal College scheme to the team. Oh, and as an aside, that video is worth showing everybody when you're at the start of preparing for your awards, because it does explain to them really well what it's all about. And again, it gives you points, because one of the things in team is that you have to have your team have to understand practice standards scheme, and by getting them all to see that video, again you can get them enthused, but also it helps you get those points. The Royal College can provide sample phrases for how to advertise your awards, and it is pushed very strongly on Find a Vet. So you can see this screenshot from Find a Vet that people can search for practices that you can put in the name, and then you can tick a box to say, I only want to see RCVS accredited practices. And certainly the number of practices that are now in the scheme is over 60%. So I think that it's good to be able to be in that list. So what happens if you don't get the award the first time? Is that a failure? So we thought at first that people would say, you know, this was a really bad thing if you didn't actually get it the first time around. But we've got a couple of quotes here from people in the team. So this nurse said, the process brought the team together and they're proud of what they've achieved. I would definitely recommend the process to everyone, both as a way of promoting themselves, but also as a team building tool. And certainly this is something that we get told over and over again, is that the team get very much involved, they take ownership of it, they feel part of it, and they're very proud of what they achieve. Even if they don't necessarily get the outstanding award the first time, they then will carry on working towards getting it the next time. This is another quote. The process was easy to get involved with and everyone at the Royal College were keen to help and were friendly each time I contacted them with my many questions. So please don't feel that you can't contact the Royal College to get help on everything that you need. So that's the end of our presentation, but both of us are happy to be around to answer any questions you might have.
Yes, absolutely. So fire away if you've got any questions.
That's great. Let's just see if questions start coming in. How many people now, how many practices have gone through and got awards, Jackie? I don't think I heard that during the presentation. Roughly?
Pam can probably tell you.
Yeah, we should have the figure. I don't have the actual figure, but I think there's about 50 odd practices, probably a few more. A lot of people, the most popular award by far is the Client Service Award, definitely. But we've got every single award in small animal has been done by somebody. We've got some equine, quite a few equine awards, and we're starting off getting going with the farm awards.
There certainly are round about 130 awards out there.
Brilliant.
Yeah, fantastic. So,
and we've got a lot of people in the process. Sorry, Anthony, we've got a lot of people in the process too. So we've got a lot of people who are have got award dates coming up, and they're working towards it.
And I think the practice sort of customer service one is so important, because that just gives you an indication of, you know, how good a job you're doing with the clients, which is just so important, isn't it? You can be so good clinically, but if they don't know you, you don't care about them, then that's a huge thing, isn't it?
Yeah, and there is research that shows that because clients don't have the expertise to judge how good you are clinically, they will judge how good you are on your customer service.
Exactly.
And that's why we all know vets who are not that good, but who have a really loyal client base. And that's why.
And that's the reason that we actually, it was important to us that we had the survey, which, I mean, practices can do their own survey, as Jackie pointed out, and the important thing of that is making changes as a result of the feedback. But it was really important to us that there was a client survey which went straight to the college, because that one Jackie showed you goes straight to the college, so the assessors will have the results of that on the day. So it's giving the clients a voice, and assessors might talk to clients in the waiting room too, and do talk to clients in the waiting room. When people come in, you know, we'll just have an informal chat with them as well.
No, that's really, really good. We have got a question, if I may, from David. Is Stanley up and running both for PSS assessment as well as awards? Who can see the information you upload?
Right, Stanley is just now up and running. We had to go through a long testing process, but we are having practices and actually going through it now. So practices as they come up, I think from the practices that are going to be assessed from October onwards, as they get allocated for October, November, they will be given their login to Stanley, and they will be able to start using Stanley. Some practices at the moment are still using an interim upload system. We have to upload the documents.
So as far as who sees the data, it's only the assessor and the practice standards people in the college, just that small practice standards team. I think some people get a bit paranoid about it being shared around the college into ProfCon and things like that, and that doesn't happen.
Great. If there are any other questions, does anybody want to come forward with any more questions? I'm obviously don't have my practice now, but I really enjoyed when I did do practice standards because it was a great way of benchmarking. I think it has developed and evolved, since I did it. And I'd just like to thank you both because I think it is a cracking scheme. And I think if people look at it in a positive way, it can but help their practice.
And that's what we want it to be, is positive. And that's the assessors, are going out there trying to help practices, not going around trying to fail anybody, because, the assessors are there to try and be helpful and advise practices too.
And, presumably most of the assessors are, or have been in practice and kind of know all the ins and outs and all the pitfalls as well. So that they are people who, as you say, want people to succeed.
Yes, the assessors have to have been in practice, and in fact we're currently advertising for some more assessors, and we want people who've been involved in running practices, been involved in the process, so they understand the pressures of all that. They're not just going to walk in and tell people to do something ridiculous and expensive without good reason. We need our assessors to have their feet on the ground.
And the assessors must have been in practice within the last 2 years.
3 years, that's right.
3 years, sorry.
Yeah.
3 years.
Great. Fantastic. Well, thank you so much, Pam and Jackie, for giving us this update on the practice standards scheme, particularly the new awards, which I do think are interesting. There's nothing quite like having a nice shiny award in reception to show your clients, how good you are in an area. I really appreciate your time, and those of you who have been watching, you may want to look over this again. This will, of course, come up onto the website, so do feel free to watch it again, and obviously tell friends and colleagues about it as well. So thanks very much, Pam. Thanks very much, Jackie, and we'll see you all on a webinar very soon. Bye-bye.